A 72-year-old man named David is sitting in his favorite armchair, the morning light illuminating the pages of his newspaper. It's a completely ordinary Tuesday. There is no warning, no sudden pain. But then, without cause, the words on the page begin to tremble and blur. The familiar comfort of his living room starts to tilt, as if the entire house is suddenly resting on a loose, unstable axis. A profound and disorienting dizziness sweeps over him. He's felt a head rush before when standing up too quickly, but this is entirely different. This feels sinister, an unwelcome intrusion into the normal rhythm of his day. As the confusion mounts and a strange tingling numbness begins its insidious creep up his left arm, his mind snags on an article he saw online, a video with a bold, promising title, "The 3-minute stroke trick doctors don't tell you." The video had been compelling, expertly produced. It showed a person at the very first sign of a stroke lying completely flat and pulling their legs straight up against a wall, forming an L shape with their body. The narrator, in a confident and reassuring voice, called it a gravity-assisted autobolus, a supposedly secret technique to flood the brain with oxygen-rich blood and stop the stroke in its tracks. For a fleeting moment, David's panicked mind, desperate for a solution, latches onto this idea. It feels proactive. It feels like doing something to fight back. But then, a more grounded memory pushes through the fog of panic, a recent conversation with his own doctor. She'd been concerned about the sheer volume of medical misinformation spreading like wildfire online. "David," she'd said, leaning forward with a serious expression, "if you ever, for any reason, think it might be a stroke, the only trick is the telephone. Everything else is just noise that steals precious time." In that critical moment of clarity, David made a choice. He consciously ignored the tempting, simple trick from the internet. Instead, he did something else. And that decision, which set into motion a sequence of simple, researched actions, would not only change the course of the next 3 critical minutes, but would ultimately be the reason he saved his brain. What David did is the real 3-minute technique. It isn't a secret and it isn't a trick. It's a proven, life-saving protocol backed by decades of medical science. And today, I'm going to break down exactly what he did, minute by minute, so that you know precisely what to do when every single second counts. Because here's a reality most people don't realize. In the face of a stroke, what you don't do in those first 3 minutes is just as important and sometimes even more important than what you do. But before we get to that life-saving technique, it's absolutely critical to understand the dangerous advice that circulates online and why it's so harmful. To do that, we first need a deeper understanding of what a stroke actually is. A stroke is often called a brain attack, and for good reason. It occurs when the blood supply to part of the brain is suddenly interrupted or severely reduced, preventing brain tissue from getting the vital oxygen and nutrients it needs to survive. Without this fuel, brain cells begin to die within minutes. This is precisely why ideas that you can stop a stroke at home with a special position, a breathing exercise, or an over-the-counter pill are not just false. They are a catastrophic waste of the single most valuable resource you have, time. Let's first explore the complex and delicate machine that is our brain, and what happens when it's under attack. The brain, despite being only about 2% of our body weight, is an incredible energy hog, consuming a massive 20% of the oxygen and glucose we take in. It demands a constant, uninterrupted supply of blood to function. When that supply is cut off, even for a few moments, the brain cells, or neurons, begin a devastating chain reaction called the ischemic cascade. Deprived of energy, their internal pumps fail, they lose their ability to communicate, and they start to release toxic chemicals that poison their neighbors, spreading the damage outward. This cascade of self-destruction is what makes time so critical. This brings us to the 2 main types of stroke. It is vital to understand that without a hospital CT scan, you have absolutely no way of knowing which one is happening. First, and by far the most common, is the motor ischemic stroke, which accounts for about 87% of all strokes. This is fundamentally a blockage stroke. Think of it like a dam suddenly blocking a river. An artery that supplies blood to the brain becomes obstructed, starving a part of the brain of oxygen. Ischemic strokes themselves are generally divided into 2 primary types. The first is a thrombotic stroke. This happens when a blood clot, known as a thrombus, forms directly inside one of the arteries that supply blood to the brain. This is often the end result of a disease called atherosclerosis, which is a slow, progressive hardening and narrowing of the arteries. Over many years, fatty substances, cholesterol, and other waste products build up in the inner lining of an artery, forming a rough, waxy structure called plaque. Think of it like rust building up inside a pipe. Eventually, this plaque can become unstable and rupture. The body, in its attempt to heal this injury, forms a blood clot right on top of the rupture, and this clot can grow large enough to completely block the artery. The second type of ischemic stroke is an embolic stroke. In this scenario, the blood clot forms somewhere else in the body, not in the brain. The clot is like a piece of debris that breaks loose and travels downstream. Most commonly, this clot, called an embolus, forms in the heart. A very common cause for this is a heart condition called atrial fibrillation, or AFib, where the heart's upper chambers beat irregularly and rapidly. This chaotic rhythm can allow blood to pool and form clots. A piece of this clot can then break off, travel through the bloodstream, and get wedged in one of the narrower arteries in the brain, causing a stroke. An embolic stroke is often sudden and severe, occurring with little to no warning. The second major category of stroke is the hemorrhagic stroke. This is a bleed stroke. Instead of a blockage, a blood vessel in or around the brain has ruptured and is actively leaking blood. This leaked blood puts immense and destructive pressure on the surrounding brain tissue, directly damaging cells and causing dangerous swelling. There are two main types of hemorrhagic stroke. First is an intracerebral hemorrhage, where a blood vessel inside the brain itself bursts and bleeds into the brain tissue. The leading cause of this is chronic high blood pressure or hypertension, which can weaken the small, delicate arteries within the brain over time, making them brittle and prone to rupture. Second is a subarachnoid hemorrhage, which is bleeding in the space between the brain and the protective tissues that cover it, an area known as the subarachnoid space. The most common cause is the rupture of a brain aneurysm, which is a balloon-like bulge on the wall of an artery that can develop over time. If it bursts, it causes sudden, often catastrophic bleeding around the brain. Now let's think back to that legs up technique that tempted David. Proponents claim it uses gravity to rush blood to the brain. But what if someone is having a hemorrhagic stroke, a bleed in the brain? Lying flat and actively forcing more blood toward the head could theoretically increase that dangerous pressure inside the skull. With the best intentions in the world, you could be making the bleeding and the brain damage significantly worse. Furthermore, a very common risk during a stroke is vomiting. If a person is lying flat on their back and vomits, they are at an extremely high risk of aspirating that material into their lungs. This can lead to a severe and often life-threatening complication called aspiration pneumonia. This is precisely why official first aid guidelines from every credible health organization do not recommend this position. It's unproven, it dangerously ignores the two distinct types of stroke, and it creates a serious secondary risk of aspiration. Another dangerous myth is immediately taking aspirin. This is another uninformed gamble with a person's life. If the stroke is ischemic, a clot, aspirin, which is a blood thinner, might theoretically help. But if the stroke is hemorrhagic, a bleed, taking a blood thinner is like pouring gasoline on a fire. You simply cannot know which type of stroke is occurring outside of a hospital setting. Paramedics and doctors will make the decision about any medication after they have the right information from a brain scan. Your job is not to play doctor. The internet is filled with these one weird tricks. All of them share the same fatal flaw. They delay the one action that is proven to work. They make you the center of the solution, when the real solution lies in getting advanced medical help to the person as fast as humanly possible. The clock is ticking. Now, let's talk about the technique that truly saves lives. It's not one single action, but a rapid, prioritized 3-minute sequence. This is what David's wife used. This is what you need to know. Minute 1, recognize and react. The first 60 seconds are for recognition and decisive action. Your mission is to identify the signs of a stroke and make the single most important call you can make. The gold standard for recognition is the acronym Be Fast. While the simpler FAST is common, the addition of balance and eyes provides an even more comprehensive and powerful tool. B is for balance. Has the person experienced a sudden, unexplained loss of balance or coordination? Are they suddenly dizzy, stumbling, or unable to walk in a straight line? E is for eyes. Is there sudden trouble with vision in one or both eyes? This could manifest as blurriness, double vision, or a complete loss of sight in one eye, like a curtain coming down. F is for face. Ask the person to give you a big smile. Does one side of the face droop or appear numb? Is the smile uneven or lopsided? A sudden facial droop is one of the most classic and recognizable signs. A is for arms. Ask the person to raise both arms straight out in front of them and hold them there for 10 seconds. Does one arm drift downwards, or do they complain that one arm feels weak or heavy? This test can also be done with the legs. It signals weakness on one side of the body, a hallmark of stroke. S is for speech. Ask the person to repeat a simple sentence like, "The sky is blue," or "You can't teach an old dog new tricks." Is their speech slurred? Are they using the wrong words or jumbling them? Can they understand what you are saying? Any sudden change in their ability to speak or comprehend is a massive red flag. T is for time. This is the action step. If you see any of these signs, it is time to call 911 immediately. This is not the time to hesitate. It's not the time to wait and see if it gets better. It is not the time to call a doctor's office for an appointment. You must call emergency services. The statistic is staggering. In a typical stroke, nearly 1.9 million brain cells die for every single minute that treatment is delayed. That's over 30,000 brain cells vanishing every second. When you call 911, use the magic words, "I think someone is having a stroke." This phrase is a trigger that sets off a specific stroke protocol, alerting the dispatcher to the extreme severity of the situation. This is the first and most critical link in what is known as the stroke chain of survival. Do not, under any circumstances, attempt to drive the person to the hospital yourself. Paramedics can begin life-saving care in the ambulance, monitor vital signs, and will alert the destination hospital. So the specialized stroke team is ready and waiting the very moment you arrive. Minute 2, position and protect. Now that help is on the way, your mission for the second minute is to ensure the person is as safe and comfortable as possible. Your primary goals are to maintain an open airway and prevent any further injury. The safest position for someone suspected of having a stroke is the Skatsianut recovery position. Gently help the person to lie down on their side. A detailed way to do this is to kneel beside them, place their arm that is furthest from you across their chest, and bend their far knee up. Then, gently pull on the bent knee to roll them towards you onto their side. Use a pillow or folded jacket to support their head and keep it slightly elevated, not propped up high, just supported. This side-lying position is critically important for 2 reasons. First, it protects their airway. If they become nauseous and vomit, gravity helps the contents drain safely out of their mouth, not down into their lungs, which prevents aspiration pneumonia. Second, it keeps their tongue from falling back and blocking their airway if they lose consciousness. This is the universal position for safety and stability. While they are in this position, take a moment to loosen any tight clothing around their neck, like a tie, a scarf, or a tight top button. If they seem cold or are shivering, cover them with a blanket. And throughout this, speak to them in a calm, comforting, and reassuring voice. Panic can cause blood pressure to spike, which is the last thing their brain needs, especially if they are having a hemorrhagic stroke. Your calmness is a powerful stabilizing force. During this minute, you must also follow one of the most important rules. Do not give them anything to eat or drink. Not even a sip of water. A stroke can severely affect the complex network of muscles used for swallowing, a dangerous condition called dysphagia. Giving them anything by mouth could cause them to choke or aspirate the liquid directly into their lungs. The hospital will perform a professional swallow assessment before giving any food or drink. That is minute 2. Minute 3, prepare and pacify. With the ambulance now just minutes away, your mission for the 3rd minute is to gather crucial information for the paramedics and to keep everyone, including yourself, calm. First, the preparation. The single most important piece of information you can provide to the medical team is the time the symptoms first started. This is what doctors call the last known well time. The most effective clot-busting drugs for ischemic stroke have a strict time window for administration, typically within 3 to 4.5 hours from the onset of symptoms. Knowing this last known well time is priceless because it directly impacts treatment options. This is because of a concept known as the ischemic penumbra. This is a zone of brain tissue surrounding the dead core of the stroke that is injured and at risk, but still salvageable if blood flow can be restored quickly. Your ability to provide an accurate time helps doctors save that precious recoverable penumbra. Next, quickly and safely gather the person's medications or a written list of them. Knowing what they take, especially any blood thinners like warfarin, Eliquis, or Xarelto, is critical for the medical team to make safe and effective treatment decisions. If you can't grab the actual pill bottles, having a list of their major medical conditions is also extremely helpful. And finally, make sure the front door is unlocked so the paramedics can enter without any delay. Now for the second part of this minute, pacify. This is for both the person having the stroke and for you. Adrenaline and fear are overwhelming in this situation. This is where controlled breathing comes in, not as a cure, but as a powerful calming tool. Guide them and do it with them. Let's breathe together. A slow breath in through your nose and a long, slow breath out through your mouth. A simple rhythm of breathing in for 4 counts and out for 6 can help lower the heart rate and blood pressure for both of you. This isn't a stroke-stopping trick. It's a panic-reducing technique. And in this high-stakes situation, that is a profoundly powerful intervention. So that is the real 3-minute technique, a sequence of proven, life-saving actions. Minute 1. Recognize, be fast, and react by calling 911 immediately. Minute 2. Position for safety in the recovery position and protect their airway by giving nothing by mouth. Minute 3. Prepare crucial information, especially the last known well time, and pacify the situation with calm reassurance. Now, let's shift our focus from emergency response to the vital areas of prevention and preparedness. For anyone over 60, or for those who care for them, the work you do before a crisis can be just as life-saving as the actions you take during one. A major part of this is understanding and actively managing your personal risk factors for stroke. Some risk factors are non-modifiable, like your age, your family history, and your ethnicity. But many of the most significant risk factors are modifiable, meaning you have the power to do something about them. High blood pressure, hypertension. This is the leading cause of stroke. Chronic high blood pressure acts like a constant, forceful hammering on the inside of your arteries. This pressure damages and weakens artery walls throughout the body, making them susceptible to both blockages from atherosclerosis and rupture in hemorrhagic strokes. High cholesterol. Elevated levels of bad LDL cholesterol are a primary driver of atherosclerosis, the plaque buildup that narrows and hardens arteries. This process is the underlying cause of most thrombotic strokes. Atrial fibrillation, AFib. This irregular heartbeat can make you 5 times more likely to have a stroke. In AFib, the atria, the heart's upper chambers, quiver instead of beating effectively, which allows blood to become stagnant and form clots that can then travel to the brain. It's crucial that AFib is diagnosed and managed, often with blood-thinning medication. Diabetes. Persistently high blood sugar levels damage blood vessels over time, which significantly accelerates the process of atherosclerosis and increases stroke risk. Smoking. Smoking is toxic to your blood vessels. It damages their lining, increases blood pressure, reduces the oxygen in your blood, and makes your blood more likely to clot. One of the most powerful and simple preparation tools is the Vial of Life program. This simple, nationally recognized system allows you to have your complete medical information ready for emergency personnel. You fill out a form with your medical history, medications, allergies, and doctor's information, place it in a plastic bag or vial, and attach it to your refrigerator. A sticker on your front door alerts paramedics, who are trained to look for it on the fridge. It's a 5-minute task that ensures you can speak for yourself even when you physically can't. Alongside this, it's wise to keep a current list of your medications in your wallet or purse. During an emergency, you may not be home or you may not be able to communicate. A written list allows any bystander or first responder to become your effective advocate. Another crucial part of preparedness is understanding transient ischemic attacks, or TIAs. Often called mini-strokes, these events produce the exact same be-fast symptoms as a major stroke, but they are temporary, often lasting only a few minutes before resolving completely. It is incredibly tempting to dismiss a TIA. The symptoms fade, so people are inclined to brush them off as a strange spell. This is a critical, often tragic mistake. A TIA is a major warning sign. It is your brain pulling the fire alarm. It indicates a temporary blockage that the body managed to clear. But the underlying cause, like a severe plaque buildup or a clot-forming heart condition, is still present and active. A significant percentage of people who have a TIA will have a major disabling stroke soon after, with some studies showing half of these strokes occur within 48 hours. A TIA must be treated as a full-blown medical emergency. Even if the symptoms go away completely, you must call your doctor or go to an emergency room immediately for evaluation. Let's return to where we began, with David, sitting in his armchair as his world tilted. He made the right choice. He ignored the dangerous online myth. His wife, seeing his drooping smile and confused speech, immediately remembered FOST. That was minute 1. She called 911 without a second of hesitation. As she waited for the ambulance, she calmly guided him onto his side into the recovery position. That was minute 2. In the final minute before help arrived, she grabbed his weekly pill organizer and made a mental note of the time he had last been fine. That was minute 3. When the paramedics arrived, they weren't walking into a scene of panic and chaos. They had a clear timeline, his medication list, and a patient who was stable and protected. Because of this, David got to the hospital quickly, received the time-sensitive, clot-busting medication he desperately needed for his ischemic stroke, and is now back home reading his morning paper. His story is a powerful testament to the triumph of knowledge over myth. And this is the single most important point I want you to take away from this. There is no secret, magical technique to stop a stroke at home. The real trick is for you to become a bridge, a fast, efficient, and safe bridge to the advanced medical care that can actually save a life. Your brain holds your memories, your personality, your future, your very essence. Don't gamble with it by trying unproven remedies you saw in a video. Trust the science, trust the experts, trust the process. Remember the real 3-minute technique. Recognize, be fast, and call 911. Position the person safely on their side. Prepare information and stay calm. This knowledge is power. If you are watching or reading this right now, I urge you to share this knowledge with someone you care about, a parent, a spouse, a friend, a neighbor, because the next life this information protects may be someone you love. Spreading correct, evidence-based information is a profound act of public service. And be sure to subscribe to our channel for more credible health information designed to empower you and keep you safe. Click that bell icon so you never miss a critical update. Thank you for watching. Stay safe, stay prepared, and remember, in the face of a stroke, you can be the one who makes all the difference.